I want to welcome you here. I want to welcome the media. I want to welcome the mayors of, I think, 6 of the municipalities are here this afternoon. Parish Council Chairman Mike Lorino, Sheriff Randy Smith, and other elected officials and representatives of other agencies. Thank you for being here. I have up here with me as well St. Tammany Parish Coroner Chuck Preston, Dr. Chuck Preston, and Clarence Poe, Director of St. Tammany Parish Homeland Security and Emergency Preparedness. We'd like to take this opportunity to update our residents and officials from our municipalities with the latest information that we have on the COVID-19 or coronavirus and what we as parish government have been doing and will continue to do. We have learned from officials of the Louisiana Department of Public Health that as of today, we have 1 presumptive positive case of COVID-19 hospitalized and being treated here in St. Tammany. This person is a resident of Orleans Parish. Their test is being sent to the CDC for final confirmation, but the state has told us they will move forward as though this test is confirmed positive and will take actions to contain it and assess the risk of spread. We have not yet received word on how this person contracted the virus, but we do know that this person is a resident of Orleans Parish who is being treated again here in St. Tammany. We have been monitoring this situation for weeks, and we have advised our own parish government employees and the public on best practices for prevention as recommended by medical professionals. And we have pushed out information on social media from credible sources. And I want to emphasize credible sources. And we will continue to do this as we get updated information. Now I'm going to call on Dr. Preston to give you further information about his experience with pandemics or issues as we have today. Dr. Preston?
Oh, no touching. Thank you, Mr. President. Again, I want to thank everybody for coming out. I have in my hand the coroner's office plan for COVID-19. We always maintain mass casualty plans and have modified it to specifically address this issue. If you can look carefully at the cover, I think it's the whole message of what you need to know. Keep calm and wash your hands. Pandemics are not a new phenomenon. If you brush off your memory just a little bit, you'll remember in 2009 we had the H1N1 pandemic, and we took a lot of common sense public health measures, and it really helped to mitigate the spread of disease. COVID-19 is really virtually the same thing. It is, I say, if you can imagine, the flu on steroids. The issue that I want to drive home is public awareness of symptoms of COVID-19, which are essentially like the flu, that you have fever, cough, runny nose, body aches. The one distinguishing feature is COVID-19 is associated with some shortness of breath and can present as a pneumonia. Normal measures are still the appropriate things to do. Wash your hands with at least a 60% alcohol solution. Once an hour, wash with soap and water. Try to observe social distancing. COVID is transmitted through a respiratory particle, so somebody who is coughing within 6 feet of you and you inhale that particle, or you get it on your hand and you rub it on your eye or in your nose, a mucosal membrane, that's how it's going to be transmitted. It is not known how long it will stay on an inanimate surface, but it is reasonable to use common sense disinfecting of surfaces. The one thing that a number of things I would like to point out. One is if you have a fever, a cough, body aches, and you feel like you have the flu, the odds are is you do have the flu. And so it is reasonable to call your healthcare provider and make sure they have the ability to test for flu, because one of the criteria to diagnose COVID-19 is you have a negative flu test. Not every healthcare provider can do that. While state testing is available, there is also private testing available. Not every healthcare provider can do that. There are some facilities who have already initiated their own protocol, in that a patient that is even suspected of having the flu doesn't sit in a waiting room, they sit in a car with their cell phone. And when a room is open for them to be examined, they call them on the cell phone, they go straight through the waiting room into an examination room. They limit the contact with staff. They wear personal protective devices. If you are identified as having COVID-19, the appropriate thing, if you are not sick enough to be in a hospital, and many people are, is then to first, the healthcare provider will likely report to the state and to the CDC, but to self-isolate. And that's true of flu also. You know, we long talk about the flu room, where the person with the flu is in that room and literally you put their chicken soup outside the door and get 6 feet away and let them bring their chicken soup inside the door. Just as true with COVID-19. So I guess one of the other points that I want to make is all of the public officials are trying to encourage you to stay calm, which is the right thing to do. But when you look at the evening news, if there's one single case in a state, the entire state turns red. And so when you look at the maps, all of the states look like you're surrounded by COVID and the entire world is involved in this pandemic. It is really a limited number of cases. They're being quickly identified, quickly followed up. Contact tracing is being done. The awareness of the public is very, very, very important. But I don't want you to get the impression that every third person in this room is having COVID-19. That is just not the case. And with that, Clarence, would you like to talk?
Yes, sir. Thank you, Dr. Preston. Once again, my name is Clarence Poole, and I am the Director of Homeland Security and Emergency Preparedness. Dr. Preston just gave you everything that you need to know about this virus and where we are today. Parish government is doing quite a few things. We started updating our continuity of operations plan to ensure that no matter how bad it gets, if it gets that worse, we will continue to provide those functions that we are required to do. We've identified those essential personnel and made arrangements for them also. What are we asking the public to do? He just gave you a lot of information, what we want. Now, in emergency management, yes, we may be responsible for anything, event that might happen in this parish and have an emergency response to it. However, an event like this is a community response. So what do we want you to do? Those things that he just told you about, want to elaborate on those things, making sure you're practicing those measures for preventive against the seasonal flu. We know that every year there's a lot of people that's lost to the seasonal flu. So we're looking at those different things. What else do we want you to do? Okay, push that message out to your organizations, okay, about this is a community outreach. This is a community response to ensure that we can contain this and we can continue to get on with our lives. Now, Dr. Preston also mentioned, guess what? This is not our first rodeo. We've seen this a number of times. We've seen it with the H1N1. We've planned for this over and over. Every year we go through our plans. We make that coordination and everything. So what do we want? We don't want you to panic, okay, because panic causes chaos. A lot of things don't get done. So that's what we want you to do. Remember what Dr. Preston just told you? Because that's everything that you need to know about the response to this event. Thank you.
So I'm being prompted by the president, which is a good thing. He wanted me just to remind you that it is transmitted through a respiratory particle. And so if somebody coughs or sneezes and you're within 6 feet and you inhale that particle or it gets into your eyes, then that's a potential for infection. And again, the notion if they cough in their hand, shake your hand, and then you rub your eye with it, well, you're kind of asking for it at that point. So, good common sense measures, cough in your elbow, wash your hands, maintain social distancing as much as possible. Thank you.
We're going to open it up for questions in a second. I do have some phone numbers, some contact information for the Louisiana Department of Public Health, the Governor's Office of Homeland Security, the CDC, and St. Tammany Parish government. I can give that right now, or I can give that after we open questions. I'll tell you what, I'll give it right now. Louisiana Department of Public Health, www.ldh.la.gov, 1-855-523-2652. That's 8 a.m. to 4:30 p.m. Monday through Friday. Governor's Office of Homeland Security, gohsep.la.gov, phone number 225-925-7500. CDC, cdc.gov, 1-800-232-4636. And St. Tammany Parish Government, stpgov.org, and Facebook at St. Tammany Parish. That's contact information. I know we're going to have some questions with regards to large groups, activities this week and this weekend. I'll open it up for questions now if anybody would like to pose any questions.
Can you first just tell us how you were alerted to the case that's being handled here in St. Tammany Parish and what information you were given at that time?
We were given the same information that we have now with no identity of the patient as of this time. We do not have the contact tracing information. I was given information from the governor's office late last night that we did have a confirmed or presumptive positive case here in St. Tammany. I was not given the name of the hospital. I did, by process of elimination, have a good idea of where it is, but it has not been announced as far as I know at this time.
Well, Slidell Memorial just about 10 or 15 minutes ago released that they had a positive case. Can you confirm that that's what this case is? Is it the same one?
If that's, we know of only one case in St. Tammany Parish at this time. What agency are you with? What agency are you with? Okay, thank you.
And then you were talking about the public events. I know there's St. Patrick's Day parades and stuff. Are there plans of canceling, or is everything?
At this time, we have no plans of canceling any public events that are planned by such organizations, St. Patrick's Day or any other events that are planned by nonprofit groups. I think they may be assessing on their own what they may do. Do we have any announcements of?
Yes, Oshner has confirmed that Slidell Memorial Hospital confirmed positive COVID-19.
Okay. So, yeah, so with regard to the events and such, we, at this time, are not making any recommendations for that. Of course, we do plan to make daily updates, not in this fashion, but we will from our office, from our public information office, be given daily updates for what's happening in St. Tammany Parish, which will be shared with all of our elected officials and the public as well, in the media.
Is there anything that you would want to say to parents of kids at schools? I know there's like senior trips being planned. Is that in discussion right now?
I have no information with regards to that. We are in constant contact with the school system, and they would be, they know to contact or coordinating with our Office of Homeland Security and Emergency Preparedness, and will be giving us information if such is needed.
And then I'm not sure if you can answer this, but do y'all know why the patient from Orleans Parish is being treated at St.
No, I do not know the reason for that. Sarah?
Are you guys contemplating closing down any parish facilities like the park or the fishing pier or anything like that?
We have no plans at this time to do such. Again, we want to put responsibility on our citizens. If they feel that they do not wish to be out in public where there are groups and such, we ask that they stay home. And particularly if they're feeling ill, or if they may have to restrain themselves or restrict themselves on their own. But at this time, we have no plans to close down any public parks and such.
And a follow-up for Dr. Preston. I think there's been some advice that elderly people or people who are maybe in a high-risk group should perhaps self-isolate or should, plan not to go out in crowds and stuff like that. Is that, do you think, sound advice?
I think that's sound advice, especially since we're in the middle of flu season, and the same precautions would apply. And the folks who are over 65 have other significant medical illnesses, risk mortality from flu as well as coronavirus. So just as President Cooper said, we have to count on individuals to self-identify that if they're having fever, cough, body aches, shortness of breath, that they should not go into the public area, whether it's flu or coronavirus.
One more follow-up. I know that in Washington State, a lot of the cases have been in nursing home facilities. Is that something you guys as a parish kind of have a beat on where all of our facilities like that are located, and are they in communication with you all as well?
Well, I can tell you that I've had conversations with at least one facility, and they are already being proactive of monitoring the temperature of people who are coming in, trying to limit the visitors who come in, not allowing people with fever who come in, and then monitoring their residents as well. And if they become feverish, then they know the protocol to use the telephone first to see if this is an appropriate patient, to go to a healthcare facility and identify the appropriate healthcare facility. And it's all about communication. It's about communicating to the EMS personnel that this person is at risk. It's about communicating to the healthcare provider that this person is at risk, the hospital, and the community.
Do you want to respond to anything about that?
I'm sorry, what was your question?
Is there any sanitation being done in the school, like any deep cleaning going on in there?
No, not that I know of. I know the school has taken the necessary precautions to address this issue, and I know that they're on top of it. To answer your questions about nursing homes, I did get confirmation this morning that the Louisiana Nursing Home Association has put in measures for restrictive personnel to come into their facility. So those things are also taking place, and as it escalates, we'll stay in contact with them and relay that message out to the public as it becomes available.
Okay, I did want to confirm that in a memo just given to me that Slidell Memorial Hospital confirms positive COVID-19 patient. At Slidell Memorial Hospital, patient safety and well-being is our top priority. Last night, March 10th, the Louisiana Office of Public Health, OPH, confirmed a patient with COVID-19 at our hospital. The patient is being treated in an isolation room, and our team of caregivers are following all infection control and prevention protocols. And they're working with CDC. They went on to say they're working with CDC and other agencies to address this. I want to remind everybody about the departments, Louisiana Department of Public Health, Governor's Office of Homeland Security, CDC, and St. Tammany Parish government can be followed up with. And with regard to hospitals, nursing homes, schools, we're fortunate in our community, in our parish, that I know that these agencies have plans in place long before an incident like this occurs, and we do know through our communication that they're prepared on their own, and they're doing their due diligence to address the matter at hand. We're very confident in that, and we stay in constant communication with these agencies through our Office of Homeland Security and Emergency Preparedness. Any other questions?
I guess just my last question is, there are still people who are going to be scared when they hear that there's someone in this community that, is being treated for coronavirus. Can you just address what you would say to those people who are...
Let me see your book. Keep calm and wash your hands. And if you feel that you may be susceptible to getting sick, getting a virus, getting the flu, then stay away from large crowds and take, heed all the warnings, take all the proper precautions, stay in touch with the local media, stay in touch with our national CDC and their websites to get information on that. But we will keep our citizens informed at least on a daily basis, or even more if it warrants to do so. So today's Wednesday. You can count on us before the weekend having further updates to see if there are any other changes. And again, with regard to events, I'm going to leave, as far as I'm concerned, I'm going to ask those organizers of events that bring large crowds to the community that they make their decisions at this time. Now, in case, in the event other matters warrant any changes to this, I'm not going to suggest that any events be canceled, but I would at this point leave it up to the organizers and those who are responsible for the large crowds, bringing in large crowds or attracting large crowds, to make decisions at this point. Unless anybody else has to say something about that, there may be a change tomorrow or Friday, but at this point there is no, that will not take place.
Dr. Preston, since this is a person from New Orleans who ended up being treated here, although we don't know why, does that make you think it's probably not a community problem, a community spread problem in St. Tammany at this point, or is it too early to say?
I think that it's too early to say, and we don't have enough information about that index case.
Doctor, is everybody that's involved in the isolation room, are they all quarantined with the patient, or?
Again, I don't have information from Slidell Memorial as to how they are handling it, but typical protocol would not be to quarantine every healthcare provider who comes in contact with that person. It would be to continue to do surveillance, to do temperature checks, to wait for the development of symptoms, and then have a low threshold to test that person. I guess one of the issues that I want to reiterate is we don't want to close down the healthcare system. Slidell Memorial has self-identified. Again, it's the same thing, that they have one patient in an isolation room being treated. That doesn't mean the entire hospital is infected and people should not be comfortable going there to get treatment. It's that one dot and the entire state turns red. So there's one patient that sounds like they're being appropriately handled in respiratory isolation. This is the same kind of measures that would be taken for somebody who has tuberculosis or other communicable respiratory diseases. We don't want to close the hospital, if you will, and then shift all that burden to other hospitals that are not going to be able to meet the needs of the public.
If there are no other questions, I'll close the meeting. I want to thank again the mayors of the municipalities that are here, Sheriff Randy Smith, other public officials and representatives of other agencies that are here. Thank you for being here. We hope this has been beneficial to you, and we will continue to keep our public informed as new information is provided to us. Please reach out to us if we can help further. Our community is safe in more ways than one, and we're going to keep it that way. Thank you.